Welcome back to Endo Power Couple. My name is Karolina, and in this segment, we're going to discuss the essential role that experts have in the process of reaching a diagnosis. This specialist is typically a gynecologist with a focus of endometriosis, and this endo doctor becomes your beacon of hope. In my last episode, I spilled the beans on the symptoms of these troublemakers and unraveled the endometriosis versus adenomyosis mystery. But first, a quick reminder. Adenomyosis involves the tissue growing into the uterine wall, while endometriosis has a ticket to travel around our body, like to the gut, liver, lungs, diaphragm, and so on. If you want to learn more about the difference between endometriosis and adenomyosis, you can check out our previous episode of the podcast. We also invite you to follow us on Instagram Endo Power Couple and DM us for a freebie. Now, let's start with the basics. The female reproductive system includes several key parts. Ovaries. These are small glands that produce eggs and hormones. Fallopian tubes. Thin tubes connecting to the ovaries to the uterus where fertilization can occur. Uterus. The organ where a growing fetus developing during pregnancy and where the uterine lining thickness each month in preparation for potential pregnancy. Uterine muscles. These are the muscular walls of the uterus that contract during childbirth and menstruation. Cervix. The narrow lower part of the uterus that connects to the vagina. Now let's talk about appointment with endo doctor. A trip to an endometriosis specialist doesn't kick off with hopping onto the exam chair right away. It actually begins with a pretty long and detailed chat with the doctor, usually taking about 30 to 40 minutes. The doctor gathers a comprehensive picture of the patient's health, taking a holistic approach by considering the entire body. I wanna add, I'm writing this script based on my own experiences with endometriosis specialist European country. Here how a doctor might proceed during the interview to diagnose these conditions. First, symptoms. The doctor will ask you about any symptoms, such as menstrual pain, pain during sex, unusual bleeding, pelvic pain, menstrual issues, pain during urination or bowel movements, other symptoms, shoulder discomfort, well-being, elevated body temperature, rapid heartbeat, and sweating and potential fertility problems. 2. Medical history. The doctor will inquire about the medical history, including any prior gynecological surgeries, illness, and hormonal treatment. 3. Menstrual cycle. The doctor may ask you about the regularity of the menstrual cycle, the duration of periods, and other menstrual details. 4. Family and genetics. There might be questions regarding any family history of gynecological conditions. 5. Pain characteristics. The doctor will carefully assess the nature of pelvic pain, pain in general, its location, how strong it is, and the circumstances in which it occurs. 6. Coexisting conditions. Questions may relate to other diseases or health conditions the patient may have. 7. Habits, like smoking, drinking, insomnia, etc. 8. Diet. 9. Urogynecological physiotherapist. It's a really important step for our health. It takes care of our whole space around in lower abdomen, not only pelvic floor. By the way, 10. Mental health. In the second step, you'll have a gynecological checkup where the gynecologist visually examine your vaginal area and use their hands to identify any issues. So yeah, they gonna put hands into your vagina. But why it is so important to have someone with endo experience even during gynecological examination? Endo doctor feel for movement and identify adhesions, tumors on ligaments, cysts, and intestinal growth. Although it can be physically uncomfortable, this examination is essential because it's one of the key steps in the process of uncovering potential problems during a visit to an endometriosis specialist. However, remember to inform the doctor during the examination if you experience pain or significant discomfort. If it becomes unbearable, don't hesitate to ask for the examination to be paused or stopped. If you have a partner, it's worth inviting them to such appointments. They are also affected by our condition, and it's good when their concerns are addressed by the doctor or when various things that they don't understand and we struggle to explain are clarified. After this step, there are also the less pleasant part, which is the ultrasound examination. However, based on this examination, endometriosis and adenomyosis can be diagnosed. Please remember the importance of the gold standard, which means the laparoscopy as a diagnostic method is no longer current. Let me emphasize, not current. Nowadays, if you're seeing an endometriosis specialist, they typically have their own ultrasound equipment in their office and they perform the ultrasound themselves after the palpation examination because they know what to look for and where. I repeat once more, it's crucial for endometriosis specialists to perform the ultrasound because following the palpation examination, they have a direct understanding of what to look for and where. Plus, they have experience for a diagnostic endo and adenomyosis with ultrasound and you don't need surgery for diagnosis, okay? The new era of diagnostic golden standard has changed. But first, quick reminder, what is ultrasound? It's a medical imaging technique that uses sound waves to create pictures of the inside of the body. During this procedure, a device called an ultrasound probe is used to send high-frequency sound waves into body, which bounce off internal structures and create images on a screen. It's a non-invasive and safe way to visualize the organs and tissues inside the body, helping doctors diagnose various medical conditions. In the context of endometriosis and adenomyosis diagnosis, ultrasound is used to examine the reproductive organs and detect any abnormalities or signs of these conditions. It's a viable tool for a specialist to get a closer look and make accurate diagnosis. Please remember that if you have a latex allergy, you can easily bring non-latex rubber with you. In that case, why it is so important to have an ultrasound performed by an endometriosis specialist immediately after the manual examination? An ultrasound examination, besides helping to diagnose potential adenomyosis or adenomyosis, can provide a detailed look at the uterus, its size, position and shape, whatever is tilted or not, assess the myometrium, measure the thickness of the front and back walls, measure the thickness of the endometrial lining. It can also examine each ovary individually to check for any adhesions, limited mobility, and the presence of cysts or tumors. Additionally, ultrasound helps visualize the Douglas pouch for the presence of fluid. Furthermore, an endometriosis specialist can assess the mobility of the compartments, known as sliding, or identify frozen pelvic conditions. However, the doctor can detect cysts and tumors on the intestines, assess the ligaments, including the uterosacral ligaments. It's important to note that a regular ultrasound done by a technician might not always be completely dependable. It highlights how important it is to have a specialist who knows a lot about endometriosis and can do ultrasound in the clinic after the examination. Sometimes, in addition to transvaginal ultrasound, it's necessary to do an abdominal ultrasound to check if there are any abnormalities in the abdominal area. Remember, endometriosis has a ticket to travel and can affect our bowels, kidneys, liver, diaphragm and other soft tissue. Also, doctors can perform a unique type of MRI called an endo-MRI, which is a distinct form from a regular MRI. I'd like to invite you to another episode focused on endo-MRI, where we'll discuss the differences. Don't forget to visit Instagram, Endo Power Couple, and DM us for freebie. And remember, knowledge empowers us, and together we can navigate the challenges and the doubts that arise because of these conditions. Until next episode, take care and keep advocating for your health and well-being. Stay tuned. Karolina.